Hello, everyone. My name is Jordan Lagunas, and I will be giving a presentation on the development of OCD. So, what is OCD? So, according to the American Psychiatric Association, OCD, other known as obsessive compulsive disorder, is an anxiety disorder in which people have reoccurring unwanted thoughts, ideas, or sensations, that being obsessions, that make them feel driven to do something repeatedly, repetitively, other known as compulsions. And some symptoms include depression and anxiety if compulsions are not done to ease obsessions. So here are a few examples of common obsessive and compulsive symptoms. One of them being the fear of being contaminated with some types of germs, and the compulsions would lead to a person cleaning their hand even if their hands go raw. Another common one is the fear, another common obsession is the fear of leaving doors unlocked or the stove on. And this leads to the compulsion of checking constantly every 30 minutes to see if the doors are unlocked or if the stove is turned off. Another obsession is an inappropriate and stressful thoughts, such as unpleasant sexual images, religious thoughts, and disturbing thoughts. And a compulsion for this it would be to utter a certain word or do something that will help stop these thoughts from forming. And the last one that I have here of obsession is the irritation when things are not in order or in symmetry. And the compulsion for this would be to arrange these items in a symmetrical way. So, what causes OCD? Well, as many other disorders, there are many factors that contribute to the development of OCD. And OCD mainly develops during the time of childhood, adolescence, and young adults. So, the first one being genetics, of course, it influences the development of OCD. There are a variation of certain genes that do seem to influence OCD, such as genes that give proteins instructions to react to or transport serotonin, as well as genes that play a role in communication with the brain. In a study that was conducted that focused on the OCD prevalence between twins, it was found out that 29% of the 165 set of twins within the study were susceptible to both ended up developing OCD together. Another factor that influences the development of OCD are environmental factors and experiences. So, of course, parents with mental health problems can increase the likelihood of their child having OCD, as well as uh, problems during pregnancies, and as well as the parenting style of certain of that children experience, such as children who are overprotected or emotionally neglected by parents. In addition, bad experiences such as sexual assault or car accidents or any other traumatic experience can cause the development of OCD. And one other major factor that influences OCD is brain abnormalities. One part of the brain that is hyperactive in OCD patients is the anterior cingulate cortex. So the anterior cingulate cortex plays a role in cognitive control, and according to a study, it is defined as the ability to attend to decision relevant information while ignoring irrelevant information. And what this means is that people with OCD have misspecified cognitive control in which they have a difficult time ignoring the irrelevant information, such as a crooked painting, because it is processed as relevant information to them. Another brain region that um, influences OCD is the thalamus, and it is involved in motor control, goal directed behavior, and emotional and cognitive processing. And it has been found that in patients with OCD, um, the thalamus has a larger volume. Another part of the brain that is also involved in OCD is the insula. And the insula plays a role in processing risks. And it has been found that in OCD patients, there's higher activity in the insula, creating a greater risk aversion. So when OCD patients are presented or have their obsessions irritating them, they will give in to their compulsions in order to avoid the risk of being irritated and stressed out. And the last main, oops, and the last main brain region that influences OCD is the orbital frontal cortex, other known as the OFC. And the OFC is known for guided learning and decision making. And it has been found that in OCD patients, had in their brains within that brain region, they had greater distant connectivity, which means that there were greater distance between neurons and um, between neurons. So ultimately, when shown images that trigger OCD, for example, showing someone who is obsessed with symmetry and that patient is showed a picture of a crooked painting, these areas of the brain are tend to be hyperactive. So, what are the treatments for OCD? Well, the main treatment, of course, being psychotherapy, more specifically, cognitive behavioral therapy connected to ERP, other known as exposure and response prevention. So, within this, OCD patients would be exposed to their obsessions, such as being a patient being exposed to dirt without committing the compulsions, without other, for example, without washing their hands. And through multiple sessions, they will eventually prevent themselves from feeling stressed and irritable if their hands are dirty. Another treatment for OCD is, of course, medication. And at first, antidepressants are recommended since it has been found that it reduces OCD symptoms such as Prozac and Paxil. And of course, if these treatments do not work, there are other extreme treatments such as deep brain stimulation, which includes electrodes that are placed within the brain of the patient that produce electric impulses. And there are transcranial magnetic stimulation as well, which is when there is a magnetic pulse that stimulates the nerve cells that help mitigate and decrease the OCD symptoms. So thank you very much.